Welcome everyone to another Aquarian webinar. And today we are going to be talking about gut health. This is a huge topic and we're going to go into a lot of different deep dives with this. And quite frankly, this might not get all done in one sitting. So we're going to have a couple follow-up webinars to cover everything. And the reason why this is such a big topic is because everybody's got some sort of gut problem. Right? The stomach pain after eating, the stomach pain from not eating, problems going to the bathroom, the bloating, the indigestion, the food baby. Everyone's experienced this at some point in their life, myself included. And the reality is, a lot of times it looks like bloating, gas, bad breath, constipation, diarrhea, but it can also look like skin issues. It can also look like food cravings, food allergies. All sorts of things can be tied into our gut health. And the reality is we're not alone. People have spent over $50 billion in 2024 globally on gut health products, that's supplements and pharmaceuticals and dietary things. 43% of Americans, or 142 million people, experience uncomfortable digestive systems at least twice a day. And 6% of people have constant gut symptoms. So that's 20 million people walking around in the US with persistent gut problems. And 34 to 68 million Americans have chronic idiopathic constipation. That basically means people have chronic constipation and nobody knows why. So literally everyone's walking around full of shit. And this is costing people between $2,000 and $12,000 a year to try and solve that chronic constipation problem that nobody knows how to deal with. And that's why they've labeled it as idiopathic. Well, the exciting thing is we have some solutions. And I am Dr. Brendan McLaughlin, and I run Aquarian Integrative Health. And together with my amazing wife, we created Aquarian to give people the healthcare that they deserve. What we wanted to do is revolutionize healthcare one person at a time, providing a comprehensive system of diagnosis and integrative treatments that foster lasting health and wellness. And it is my belief that true healing comes from repairing all levels of our health. And what that means is that's our physiology, our biochemistry, our bioenergetics, and our consciousness, or our mind, body, and spirit. I also believe that we are completely inseparable from our environment. And so if we have bad environmental inputs, then we're going to have health problems. And the reality is, when it comes to medicine, and when it especially comes to gastroenterology and gut health, there are clear voids in modern healthcare that need to be addressed. And when we're talking about gut health, it's number one is the over-specialization of medicine. And so the gastroenterologist doesn't understand what the endocrinologist is doing, doesn't understand what the orthopedic surgeon is doing, and all of these systems in the body play together. And when we over specialize, we don't look at the system as a whole. And there is a fundamental lack of understanding of basic physiology in medicine, sadly. And especially when we're talking about gut health, it's the relationship between the stomach, the liver, the gallbladder, and the pancreas and the intestines, and how all of that all works together as one unified system, not separate parts. And in modern medicine, there's an overemphasis on biochemistry, right? If we just address this chemical imbalance, then we'll magically fix everything. And when we're talking about gut health, that doesn't equate for the effects of radiation and EMF and all these other problems that directly affect our gut microbiome, but nobody talks about it because there's not a biochemical solution for it. And there's a massive lack of understanding of our circadian biology. And the reality is our light environment controls our microbiome, not a probiotic, not a magic supplement. It's our light environment that controls our microbiome. So we have to understand circadian biology in order to understand gut health. Big problem too in modern medicine is there's an inability to find the primary cause. What is the actual thing driving the gut issues? And so it's not about giving anti-inflammatories. It's not about just willy-nilly giving antibiotics. It's not even about giving probiotics to try and make you feel better. Usually we have to get to a primary cause, and often that means we have to figure out what we need to remove from someone's environment or from their internal terrain so that they can get better. And even when modern healthcare sort of decides that there's something wrong with the gut, oftentimes it's a one-size-fits-all killing spree, or it's just, here, take this one pill and it'll magically cure all your problems. And the reality is, especially when it comes to the gut, this often presents more challenges than solutions. And so our promise is to everybody that we will find the primary cause to your health problems. We will work relentlessly to help you achieve optimal health, and we have your back through the entire process. And because we do those things, we can create lasting change to your health and well-being. And what I'm always after is trying to create true lasting health in somebody. And when we're talking about gut health, this is not just slapping on quick supplements or quick prescriptions just to solve a quick problem. It's how do we build a resilient, healthy gut that can withstand modern life? And so today, I want to start off by talking about some of the limitations in standardized testing with gut health. And then we'll get into some false beliefs around gut problems. And then what really drives gut health, like what is actually the issue at play. And then I want to provide some understanding about treatments that can work once we understand what the real causes are. Okay. And the first myth I want to get out of the way is the fact that gut health and gut problems are just intestinal. And the reality is that couldn't be further from the truth. So not only is it your intestines, it's your liver, it's your gallbladder, it's your pancreas, it's your stomach, and the interplay between all these things. And the reality is our gut is the integration of structural, physiological, neuroimmunological mechanisms between all components of our digestive system. And that starts in our mouth and goes all the way to our colon. And it's that system's interplay with the rest of the body that forms our health. And so any discussion on the gut has to include our teeth, has to include the oral microbiome, the stomach, the small intestine, liver, gallbladder, pancreas, large intestine, colon, the enteric nervous system, the vagus nerve, the thyroid, the adrenals, the brain. And so it's not just you have an intestinal problem. This is all at play constantly, all the time with any gut health problem. And so, as you can see here, the human digestive system is a very complex, very beautifully designed system. And we can have problems at any point in the system. So to divide these things out and artificially separate these things out doesn't make sense. And when we look here, this is the gut with the overlay of what's called the vagus nerve or cranial nerve 10. And in a real way, the vagus nerve drives the function of the gut. And so our autonomic nervous system controls the function of the digestive system and the immune system of the gut. And this is a two-way street. So we have the nerve signals from the brain down to the gut, but we also have signals from the gut back to the brain. And 90% of vagus nerve fibers are actually going from the gut to the brain. Okay. And so the vagus nerve is so important in this gut health conversation. And it is something that is often missed or dealt with separately that needs to be attended to often before we do any types of interventions. And this becomes important because the vagus nerve can become blocked. And what I mean by blocked is there can be toxins that cause decreased function and nerve impulses within the vagus nerve. And a lot of times that's mercury from above, meaning from the teeth and the face, and glyphosate or pesticides from below. And so this super important nerve that regulates our entire digestive process is getting filled with different types of toxins and pathogens all the time. And that can create a real problem. And we can also see, when we understand the vagus nerve a little bit more, how pathogens can move from the brain to the gut and vice versa via nerve transport along the nerve axon. Okay. And a lot of people, when they talk about gut, the first thing that comes up is like leaky gut. And leaky gut, all that means is there's an inflamed gut. And when the gut is inflamed, the barrier that should keep everything within the digestive system starts to allow things into the bloodstream. And when you allow things into the bloodstream, we can have big problems, because all the stuff that's supposed to be in the gut, the bacteria, the other pathogens, food particles that are undigested, they start to get into the rest of the bloodstream, and they can start going everywhere. And that's why when we look at research on leaky gut, it's associated with so many different conditions, because all of these toxins and pathogens and food particles can move via the bloodstream to other parts of the body and cause a whole host of problems, including autoimmune conditions, food allergies, asthma, acne, chronic fatigue, fibromyalgia, mental problems, Parkinson's, anxiety, and depression. This just underscores the fact that we cannot deal with any system in isolation, and it's foolish to do so. And so right off the bat, we need to understand that this conversation on gut health has massive implications for the rest of the body, not just our digestive health. Okay? And so when we begin to understand this, we just say, right, well, we can fix everything with food. I just have to improve my diet, stop eating McDonald's, et cetera, et cetera. And on some level, this is a myth. Okay? And we all love eating different kinds of things, especially pizza. And they just say, look, I will cut out the pizza and my digestion will be better. Unfortunately, most of our food nowadays, even the stuff that's deemed healthy, is just highly processed, industrialized chemicals passed off as food that provide little to no nutrition. And there's a saying that the standard American diet leads to standard American diseases. And the reality is the standard American diet is sad. Majority of it is processed and refined foods, adulterated foods. Most things are sprayed with poisons, unless they're organics, or pesticides, herbicides, fungicides, rodenticides. We eat food out of season, which makes it at odds with our own circadian biology and makes it less nutritious. We eat food that's shipped from all over the world that's not local. We eat food that's been kept in cold storage, which decreases its nutritional value. We add colors and flavors and preservatives into the food, and we store food in plastic packaging, so we're getting microplastics on our food. And then we cook the living heck out of it in a microwave, which destroys all of the life force within the food. And the reality is, when you mess with food, it becomes junk. And what I would say is, real food doesn't cause disease, junk does. So the solution is eat real food. That's as simple as it can get. And we will get into the weeds a little bit about different diets and different things. But as a fundamental base, if I'm not eating real food, real unprocessed food, well, then I'm going to have problems. It's just a matter of time. But unfortunately, food is only part of the story. I say that because 99% of the people we see who have chronic gut problems have tried all sorts of elimination diets, all these special gut healing diets, have changed their diet dramatically, and still come into our office with persistent digestive issues. And so what I would say is, the standard American lifestyle leads to standard American diseases. And that food is a Band-Aid until the root causes are understood and corrected. So don't get me wrong, it can be super helpful to eliminate foods that are causing gut irritation, that are causing a whole bunch of problems, but they're not solving anything, fortunately. And so the question becomes, well, what's the rest of the story? The rest of the story is toxicity. And when it comes to the gut, that's a large part plastics, pesticides, and pollution. That's bacterial infections, fungal infections, heavy metals, parasite infections, the effect of EMF on our gut microbiome, blood flow issues, scar tissue, brain trauma that can precipitate as gut problems, neurological constipation, circadian rhythm disruptions, and emotional trauma. All of these things play a bigger role in gut health than food per se. And I believe, after working with many, many patients over decades, at the root of gut problems, there's an infection, a toxicity, or an emotional trauma not identified, and an environmental mismatch. So trying to address gut problems with just food is analogous to having your house burning down and saying, right, well, we're just going to rearrange the furniture and hope the house stops burning down. That's a little bit foolish, okay? And we know food's not the only solution and kind of a Band-Aid. We know there's all these underlying things going on. We know that there's a massive interconnectedness within the gut and the intestines and the rest of the body. So the question is, where do we begin? And we have to start at some point to form a diagnosis of what's going on. And so usually we start with testing. And there's a big myth that standard testing methods tell us exactly what's wrong. And that's a big myth because the testing used for gut health doesn't really tell us why something's happening. It can say, oh, there's inflammation, or oh, there's this problem, but it doesn't tell us why. And so something like a colonoscopy, you can see inflammation, but you won't see any infections. And so we're looking for inflammation, we're looking for cancer, we're looking for polyps or ulcerations, but it doesn't tell us why they're there to begin with, if they are. And the problem with colonoscopy is it can lead to other types of infections actually during the procedure, which most of the time we want to try and avoid. With biopsies, usually they'll try and do a biopsy from the duodenum, or the first part of the small intestine. And a lot of times you can get a false diagnosis of celiac disease with that, because there's an autoimmune pernicious anemia at play. And what that means is there's a vitamin deficiency causing problems that looks like celiac when they do a biopsy. And so all of a sudden you get this biopsy, you're told you have celiac, you get put on all these other things and restrictive diets, and you still feel like garbage. So we can do better than that, right? Stool samples can be very, very helpful. We utilize them in our office. The problem is stool samples, most of the time when you do them through the big labs, it's 1 day stool sample, and that doesn't really tell us anything, okay? So ideally you do an 8-day stool sample, but at bare minimum, it has to be a 3-day stool sample. With blood work can be helpful, and we'll go through that, but it won't catch certain types of infections. It won't catch heavy metal toxicity that can affect the gut. It won't catch a lot of these things that are deeper down and kind of the why of why some of these things are happening. Allergy testing can be helpful, but most of the standard allergy testing is testing for proteins. So they're looking at proteins from egg or from gluten or whatever, and testing proteins is not particularly accurate. You have to test the peptides, which are the sort of the breakdowns of the proteins. Now, there's certain labs that do that, but that's not in sort of the standard testing methods. And so all of these things can be helpful, again, to pick out the bigger issues or to see inflammation in different parts. But one, if they're not interpreted properly, that's dangerous because it can lead us down roads that we don't need to go down. And two, there's massive limitations in getting to the root cause of the issue. And with standard testing comes standard interventions. And so if you say, okay, there's just inflammation and we have to fix that, well, then you're going to get put on antibiotics, you're going to get put on immunosuppressants, antacids, high-dose NSAIDs, chemotherapy drugs sometimes, or laxative. And so at best, you're treating symptoms. At worst, you're ignoring deep root causes and making things worse. And so we have to ask ourselves, why are the symptoms there? And because antibiotics are the first line for every gut problem, I wanted to elucidate this a little bit. And this is a study from 2007, and there's many, many studies to show exactly this. Excessive antibiotic administration can paradoxically cause bacterial infections in the gut, specifically C. diff. It can also cause neutropenia or low neutrophils, thrombocytopenia, which is low platelets, or pancytopenia, which is low everything. So when we take antibiotics excessively, what happens is it creates a massive hit on the immune system. Okay, so our immune system can't mount a response to anything anymore. And that allows for different types of bacteria to overgrow. And so we think we're doing something good, but because it has such a widespread effect and because we need our microbes in our gut, we can end up with all these other infections that are completely resistant to antibiotics, and we get more stuck than when we started. So I firmly believe that we can do better, okay? And doing better starts with each and every one of you and understanding your own body a little bit more when it comes to gut health. And so we need to go back to basic. And when we go back to basics, easiest thing to look at is look at your tongue. If there's a coat on your tongue, whether it's white or yellow, that means that there's potentially a problem with your oral microbiome or your gut microbiome. Could have inflammation in the stomach caused by an H. pylori infection, IBS, reflux, liver dysfunction, massive levels of dehydration. And the reality is the same coat that you have on your tongue, you will have in your entire digestive system and in your gut. And this line of thinking has been known for thousands of years because in Chinese medicine, we utilize the tongue to look for any deficiencies or excesses, which we can see in different types of tongue patterns that instantly give us more diagnostic information about how the gut is doing. Okay. We can also look at the urine. And so excessively foamy urine is a massive red flag when it comes to gut health. Okay. Because that can indicate kidney damage, a urinary tract infection, gut dysbiosis, and more often nowadays, a parasite infection, specifically schistosomiasis. And in sort of the West, in Canada and America, we don't think of parasite infections as being prevalent, but they are. I've seen dozens of patients with schistosomiasis infections. And the reality is it's the most prevalent helminth, which is a type of parasite infection in the world, and can cause bladder infections, can cause gut problems, can cause cancer. And so the foam comes from excessively trying to get rid of the parasite eggs. Okay. And so again, between our tongue and our urine, we can have a very good prognostic indicator of what's going on with our gut. And then when we look at our stool, the Bristol stool chart is kind of a very famous thing. Ideally, we want to be a type 3 or a type 4, okay? When we start getting into type 7s or type 1s, we know we have a real problem. Normal stool should be dark, sink in the water, and it shouldn't smell at all. And when we see stool that has a really light color, it means that our liver is not producing enough bile and or our gallbladder is not releasing enough bile to digest the fats in our intestines. If it's very dark, we're not resorbing the bile salts and they're staying in the feces. If it's dark red, there's upper GI bleeding, so somewhere in the stomach or the small intestine. If it's bright red, there's lower GI bleeding, so somewhere in the colon. And if it's floating, that means there's a lot of undigested fats in the stool, and that makes it float. So again, we have to look at the liver. We have to look at our fat digestion. We have to look at our pancreas. And if there's a really rancid smell, usually that's undigested fatty acids. Sometimes that can be undigested proteins as well. So right off the bat, just looking at our stool, we can say, okay, what's my liver function like? What's my gallbladder function like? What's my pancreatic function like? And that can give us a good idea. Also, going back to basics, what we can do on our own is paying attention to our temperature. I've talked about this before because I think it's just so important. Ideal oral temperature is 98 to 99.5. Most people have a chronic low temperature. And that's a problem because all of the enzymes in our body that facilitate the chemical reactions are very temperature specific. And they assist in metabolism, the immune system, the nervous system, and detoxification. And so when we have a drop in temperature, we have a drop in enzymatic function, which leads to more and more pathogens building up in our body. And so we may not get acutely sick anymore as much as we used to, but the rates of chronic illness are skyrocketing. And a big part of this is because of temperature. And so when we look at this study, I included this in here because I wanted to show you that the average temperature, and this is in America, since the Industrial Revolution has massively decreased across men and women, to the point that the sort of standard 98.6, which has been that way forever, a lot of medicine is trying to say, well, no, it should be lower than that. But when we actually dig into the data, it's just because across the board, we are getting sicker and sicker and sicker. Our metabolism is weaker and weaker and weaker, which is presenting a whole bunch of challenges, especially for our gut health. When we start moving into blood testing and actually going to get bloods done somewhere, we have to understand that blood testing is a snapshot in time, okay? And we need to correlate any of the results on the blood test with presenting symptoms, with physical exam, with advanced diagnostics, and the context of the person that has done the bloods. And if we don't do that, well, then we can make assumptions about a whole bunch of other things. And a simple example of that is there's a lot of basic blood markers that can be out of range and they correlate directly with dehydration. So simple asking, how much water do you drink? How much did you have that day? Et cetera, can be very, very helpful in understanding the context of when the bloods are taken. We also have to understand that there's a huge difference between disease values and optimal values, okay? A lot of the times when people bring blood work from other practitioners or stuff that they've done on their own, and they say, well, Brennan, everything is in range. And I say, okay, but it's far from optimal because there's a massive difference. And what we have to understand is the range values that most labs use are just a rolling average. And as a society, as we get sicker and sicker and sicker, the ranges start shifting and changing. And so with that kind of understanding, some of the standard blood tests that most docs will do, if you're having some gut health problems, to look at C-reactive protein, which is just a marker of inflammation. Same with ESR, okay? And that can indicate certain types of inflammation that could potentially be something like Crohn's disease or ulcerative colitis, but it's very, very non-specific, okay? Typically, they'll look at liver enzymes. And it's important with liver enzymes to understand that liver enzymes go up and down all the time. And so unless they're extremely, extremely high or extremely, extremely low, we have to take it with a little bit of grain of salt. We also have to understand that low liver enzymes, a lot of the times, are a vitamin deficiency. So low ALT is vitamin B6. And same with low AST is vitamin B6 as well. We also have to understand that high liver enzymes, yes, they can be bad things like acute hepatitis, liver cancer, these kind of things, but they can also be autoimmune reactions. They can also be reactions to certain kinds of drugs that people may be on. And so we have to understand, again, context of the person. Also, we'll look at a standard kidney panel, which can give us some clues of some things. Fasting glucose, which will give us some clues about what the pancreas is doing. And then a lot of times what a lot of docs will do is they'll do a vitamin B12 iron and folate and look at those things. Now, if those are low, it could be a malabsorption problem. So just taking more is probably not going to solve the problem until you figure out why you can't absorb those things. Or it can be an autoimmune reaction. And so if it's an autoimmune reaction, giving more is going to cause more problems. Okay. And the reality is, when it comes to nutrients that we can measure on a blood test, even basic blood tests, the right levels are so reliant on well-functioning digestive system, especially your small intestine, right? 95% of nutrients absorbed in the small intestine, okay? And when we get into the large intestine, it's mainly electrolytes and vitamin K. So any time that we're doing blood testing for nutrients and they're low, first thing we usually have to think is there's a malabsorption problem, probably in the small intestine. And especially if you've been supplementing and then you go get follow-up blood work and it's still low, there's a deeper issue and there's a reason at play why these things aren't getting absorbed that has to be figured out. And so with blood tests, when we go a little bit deeper, one of the things that I traditionally run is ALP, or alkaline phosphatase. And in sort of allopathic medicine, a lot of times they'll run that to look at bone pathology or a marker of severe liver issues. But the reality is ALP plays a massive role in the gut in general. It's involved in removing endotoxins out of the gut, regulating intestinal inflammation, and promotes the growth of good bacteria. And so if this is high, I'm thinking malabsorption, inflammation, or some kind of intestinal permeability issue. So without doing any other advanced testing, we can get a very good clue of what's going on. If it's low, that usually means it's some kind of malnutrition potentially, but more than likely a zinc deficiency. And if it's a zinc deficiency, we'll do a follow-up test looking to see if someone has KPU, and KPU is cryptopyruria. And basically that means your body excretes superphysiological doses of zinc, other minerals, and other vitamins. And we can run a simple ALP test on some basic blood work to give us those clues, because a KPU test, there's only 1 or 2 labs that do a good job of it, and they're quite expensive. So we can get a good marker of that right away. When it comes to liver, I always look at GGT and autoimmune liver panels. And GGT measures the amount of the GGT enzyme in the blood. And it's also mainly found in the liver, gallbladder, spleen, pancreas. If it's high, it means that there is a bile duct obstruction. And so the bile that gets produced in the liver has to flow from the liver through the bile ducts into the gallbladder, into the small intestine. And if the GGT number is off, we know that there's a problem in the liver when it comes to the bile. I also look at autoimmune liver panels, and the amount of patients who have autoimmune issues in their liver has skyrocketed over the last 10, 15 years. And it's a very, very important thing that doesn't show up on standard blood work. So oftentimes for our patients, they'll have their ALT, AST fine, but when we dig into their health history and we dig into other things, it sounds like a liver issue. And then when we run the autoimmune liver panel, they have some deep-seated liver issues causing those to be positive. Now, we'll get into this, but an autoimmune issue in the liver just means there's some kind of pathogen or toxicity chronically stimulating an immune response in the liver, and the body doesn't know how to deal with it. So it's not putting someone on immune suppressive drugs. It's not doing any of that. It's diving deeper into figuring out why there's an immune reaction in the liver specifically, right? And when we look at the pancreas for our blood work, we look at lipase and amylase. So lipase is the enzyme that digests fats. Amylase is the enzyme that digests carbohydrates. So if any of those are low, that means the person's going to have trouble digesting fats or carbs. And obviously that's going to present a whole host of other issues that we need to explore. We also look at C-peptide, and C-peptide is a precursor to glucose to A1C as far as looking at how someone's managing their blood sugar, because it gives us really good clues on how the beta cells in the pancreas are functioning. Okay. And in this post C19 world, a lot of people have very skewed C-peptide because of those infections. Okay. Which leads to very poor blood sugar control and a whole host of problems. And this value on blood work will often precede glucose and A1C by a couple weeks or months. So it's an important thing to look at. When it comes to the stomach, we look for autoantibodies to H. pylori, which is a specific type of infection that can infect the stomach. We look for intrinsic factor blocking antibodies and antiparietal cell antibodies. So basically, how well the body can produce B12 and absorb B12 in large part can be affected by some kind of autoimmune issue going on within the cells of the stomach that needs to be ruled in or out before we go ahead and give someone vitamin B12, which is why a lot of times people will take B12 to get more energy or to help their gut and have paradoxical reactions to it. When it comes to the intestines, we look at TMAO, and basically what that's showing us is if there is some atherosclerosis, so thickening within the blood vessels due to any kind of dysbiosis in the gut, okay? This is one of the things that connects the gut to things like stroke, heart attack, Alzheimer's disease, because of the thickening of the blood vessels. A lot of different types of bacteria that can increase TMAO. And so without doing a full comprehensive bacterial analysis that we may or may not do later, we can get some good insight on what someone's microbiome is doing. And if they have any type of condition related to atherosclerosis, we can clearly connect it right into the microbiome. The other thing we always run on gut health people is a thyroid panel. So a full comprehensive panel, because often at the root of gut dysbiosis is a thyroid problem, especially with something like small intestine bacterial overgrowth. Because what happens is if I have a thyroid problem, I have a slow metabolic rate, which means I have slow digestion, I have low temperature, I have all these things, and my gut becomes a breeding ground for different pathogens, and I have an inability to detoxify things in an appropriate time. And so I can get into a whole bunch of trouble that way. So again, the whole body is completely connected together, and we have to, if we're going to be serious about it, even from a blood work perspective, we have to dive deeper on some of these things here. Okay. I just wanted to make a note quick about H. pylori testing. A lot of times in standard healthcare, what they'll do is they'll do a H. pylori breath test. And you do the breath test and they say, oh, you don't have H. pylori. The reality is that breath test is not accurate. Okay. And so what we want to do, we usually do blood antibodies, which can be helpful. We can do a stool antigen test if it's a 3-day test. If they are in the blood, it means that someone's had an H. pylori infection for a very, very long time, usually 5 years or more. Okay. So it's leached from the gut into the blood, like I showed you with some of the leaky gut pictures. Okay. And at that point, then an H. pylori infection can cause brain fog, joint pain, a whole host of other problems. We also use our bioresonance technology and autonomic response testing to pinpoint if someone has H. pylori and exactly where it is in the body. Normally, people, when they think about H. pylori, they think, oh, it's just stomach ulcers, right? Like if you have stomach ulcers, it's H. pylori. But H. pylori can also cause acid reflux, indigestion, heartburn, cause hypoglycemia in extreme cases. And again, if it's gone into the blood, brain fog, joint pain, and a whole host of problems. So the other thing too is H. pylori and nickel are directly correlated. So again, it's not just about killing the infection. It's about, is there a nickel problem in the body that's precipitating the pathogenicity of the H. pylori infection? Because H. pylori is going to use nickel as a food source. So first thing we want to do is remove any sources of nickel from someone's daily life. Lots of teas are really high in nickel. Vegetable oils are often high in nickel. Peanut butter is high in nickel. A lot of grains and cereals are high in nickel. And so we want to remove those things. And then if someone has any kind of dental appliance in their mouth or dental amalgams and has a persistent H. pylori infection that won't go away, that needs to be considered as far as removing those things, because that's just a consistent source of nickel that the body has to deal with, that this type of infection is utilizing. So again, I'm pointing this out just so you guys understand that there's levels to all of these things, right? So one, we have to identify what the things are. So standard blood testing probably isn't the only thing we want to rely on. Two, different types of standard testing can see reflux, see inflammation, see those things. But why? Okay. If it is an H. pylori infection, great. That doesn't mean we just go in and heal everything. We also have to look and see, is there things in the internal terrain of someone's body that are precipitating these microbes? Okay. Also with blood testing too, a lot of times, in addition to thyroid hormones, we will look at sex hormones too. And that's because different sex hormones will precipitate different things to happen in the gut microbiome. Okay. So if someone has high testosterone, high DHT, if they're a man, that often protects against issues in the gut, which is part of the reason why women tend to have more gut issues than men, because their androgens will be lower than men. Men with IBS, though, have higher sex hormone binding globulin. So they might be producing enough testosterone and DHT, but they're also producing a lot of the globulin that's binding to those active hormones, and they have more stomach issues than the guys who have low sex hormone binding globulin. And estrogen is a big one, because estrogen causes pain and sensitivity in the gut. And a lot of times giving women estrogen increases IBS risk, also increases IBS symptoms if they already have it. And a big part of this reason is because excess estrogen causes the immune cells to degranulate, specifically the mast cells. So if you've ever heard of mast cell activation syndrome, that stems from excess estrogen. And what happens is you get this huge histamine release. So if anyone has a problem with histamine containing foods that are precipitating their gut health, we really need to look at sex hormones, especially estrogen. And if we want to look at leaky gut from a testing standpoint, there is the zonulin test. So serum zonulin measures the zonulin levels in the blood. And zonulin is important because it regulates the junctions between the cells of the gut. So if zonulin is high, that means your gut is more permeable than it should be. Okay, so that picture I showed before, it means stuff can get into the bloodstream. Okay, we also look at zonulin antibodies. One, because it's a little bit more accurate than just looking at zonulin levels. Not every lab does that, so it depends kind of on the lab, right? We also do antibody testing for lipopolysaccharides, occludin and actomyosin. So lipopolysaccharides are fragments of bacterial cell walls, and it's an endotoxin. So it's a toxin that's being produced inside of your body, which really triggers the immune system and can cause a whole bunch of gut health problems, okay? Even in very small amounts. So we always want to pay attention to that. Occludin and actomyosin are other tight junction proteins that can find their way in the bloodstream. So if someone has positive zonulin antibodies, positive antibodies for occludin and actomyosin, we know that there's a leaky gut situation going on. And if they have antibodies to LPS, it means that they're producing a lot of endotoxins within the gut, which can be very pro-inflammatory. Okay. So that kind of covers much of what we do sort of with blood work, but we also have to do other types of testing. And when we get into some of the more advanced testing, one of the things that we always do on just everybody is a total tox screen. Okay. And this is a urine test, and it's looking at molds, mycotoxins, heavy metals, pesticides, plastics, chemicals, you name it. And the reason we do this is because if someone's popping with all of these high levels of different things in their urine, it means there's an overflow from the gut. So gut can't handle it. It overflows. We start to pee it out as a form of detoxification, and that will show up on a test like this. So it gives us a very good clue of, one, what the body's dealing with, and two, how much burden the gut has from these different things. And again, gives us more idea of why something's happening. Big thing too is gluten testing. And everyone wants to be gluten-free and all of these things, but we may not necessarily have to. The important thing with gluten testing is you can have a gut reaction or you can have a neurological reaction. So some people will say, why do I need to do gluten testing? I don't have any digestive issues. But based on some of their blood work, we see that they have leaky gut type issues, they have liver issues. And so we want to get clear on how gluten's affecting their body neurologically, because they have brain fog and fatigue and all these other things, but they don't necessarily have gut issues. So we want to look at different types of proteins, right? We want to look at gliadin, we want to look at glutenin, which is usually not tested. You have to do specialty lab testing. We also want to look at deaminated gluten. We also want to test for glyphosate at the same time, which is why we do this test. Because most of the gluten problem in folks is because of how the grains and cereals in North America, and quite frankly, most of the world, are treated. And they're treated with pesticides, which cause a whole bunch of gut damage. So we want to look at all of these different gluten protein markers. We also want to look at toxins, especially pesticides, with something like a urinalysis. It's also important sometimes too to consider a lot of different things have cross-reactivity with gluten. So corn, oats, instant coffee, a lot of food coloring, stabilizers, food starches, condiments, different things. And we use Cyrex Labs for this. So sometimes people won't have a frank gluten issue, but they'll be cross-reacting with a whole bunch of stuff. And basically the immune system can't tell the difference between gluten and all of these other things. So a lot of times we have to do different resets for the things that aren't gluten, but react the same way in the body. Then when we get into stool samples, like I said, you need a minimum 3-day sample. Okay. If it's just a 1-day sample, it's somewhat useless. And when we're doing a stool sample, we can look basically at inflammatory markers. So lactoferrin, calprotectin, lysozyme, white blood cells, mucus, secretory IgA. We're all basically looking at, is there gut inflammation? Is there irritation? And is there some kind of infection? This can be very helpful, but it needs to be stacked with other testing to really understand the root cause. Because again, if we're just going to blame it on a bacterial thing, but the bacterial thing is caused by heavy metal toxicity like H. pylori, or caused by pesticide toxicity or whatever, we have to stack all of these things up and look at it together. Okay. And this is just a sample of one of the typical stool tests we do, going a little bit deeper, looking at a whole bunch of different markers. The important thing to consider with stool samples is when we're talking about bacterial infections, most stool sample companies don't homogenize the sample, okay? And so you can take 2 samples from the same stool and get wildly different results of bacteria. And that's why we use companies that homogenize the sample together. So I don't give the counts themselves that much confidence, but I look for trends in the data, and I look for, okay, what is this species of bacteria using as a substrate? Like, what is its food? I look for what metabolites they produce. Is it the metabolites that are causing an issue in someone's gut? And I look for what adaptations are they providing? What is going on in someone's environment or their internal terrain that is requiring this bacteria to be high. Okay. Another note on stool samples: in this post C19 world, patients who've had infections have less bacterial diversity. They have lower abundance of bifidobacterium, okay, and an increased abundance of Bacteroides. And this is very important because many of the patients that I've seen post C19 issues have persistent gut problems, okay? And this is one of the reasons why, but this is an important thing to think. And again, context is important. So understanding, has someone had an infection? How many have they had? All of these different things become important to tease out. With stool samples too, we always think, oh, we can catch parasites on a stool sample. And the reality is that's just not true. And it's not true because parasites autolyse when they leave the body after about 20 minutes. And at least in North America, how most stool samples work is you collect them at home over a couple of days, and then you put it in a box, and then FedEx takes it to the lab, and then it sits at the lab, and then they test it. So if there was a parasite present in the stool, by the time it gets to the lab, it won't be there anymore because they've self-destructed. Also have to realize that parasites don't live in poop. Usually it's only the dead adult ones or eggs, okay? Living adult parasites live in the lining of the gut, not within the digestive system itself. And they hide behind mucous membranes, they hide within biofilms. And this is an important thing to consider because we won't see these things on a colonoscopy either. Now, if you do get a stool sample and it doesn't show parasites, but there's red blood cells in your stool, or there's white blood cells in your stool, 9 times out of 10, that means there's a parasite infection. So we have to figure out, okay, as far as the parasite question is concerned, and other microbes that won't show up on the stool sample, how can I test for those things? That's one of the reasons why we use different types of advanced diagnostics in our office. And so one of the things we do is bioresonance testing. And bioresonance testing is a non-invasive technology that measures the electromagnetic signatures of the body and the organs down to the DNA level. And it allows us to assess the whole body within a couple of minutes. And we can pinpoint precipitating stressors in the gut like parasites and get a complete picture of someone's terrain very, very quickly. Okay. We also do autonomic response testing. And autonomic response testing is a specialized neurological testing to discern what causative factors are in someone's gastrointestinal issues and where exactly in the body they are. So with autonomic response testing, we can see, is it in the organ itself? Is it in the extracellular matrix, like between organs? Is it inside the cells of the organ? And we can get a very clear picture of that. And we can also discern how different components of the gastrointestinal system are working together or not working together, and what actually is the lead driver of the problem. Are all the gut problems because there's a liver issue that's precipitating pancreas issues and intestinal issues? Is it a stomach issue? There's a whole bunch of other things. Is it a problem in the mouth that's precipitating out gut problems? We can see this very easily and very quickly with autonomic response testing, which is why we do it with every patient. And we also can look at multiple different stressors in the body at the same time: molds, parasites, toxins, heavy metals, and get a clear idea of exactly what the major burdens are. And then from there, we can quickly discern what remedies are needed to address the stressors. So when we combine blood testing with stool testing and urinalysis and bioresonance testing and autonomic response testing, all of a sudden we can build out a very, very clear picture on why someone has a gut problem, where someone has a gut problem, and what sort of the root causes are, and then build out a program of therapy to actually heal for real the gut problems. And huge reason why we test everything is a lot of the times people will come to us and they've done good interventions gone to good people, but they've just done them at the wrong times. They've done things sort of out of order. And the reality is we do all of this testing because we need to do the right intervention at the right time and in the right dose. And that's not just medications or supplements. Dose can be anything, the right foods in the right amounts, all sorts of different things. So we go through all of this testing to figure out exactly what's wrong, where in the body it is, and exactly what we need to do about it, and the process we go through to do that. Okay? And so just to give you an idea, I wanted to share this with you. This is a case, it's a 26-year-old female with persistent gut issues. She had a history of severe gastrointestinal pain, problems with defecation, bloating, nausea. And when she came to us, she had tried, quote unquote, everything. Okay. Her blood work was normal. Her food sensitivity said she was allergic to gluten. She had a colonoscopy, said it was normal. She'd been to a whole bunch of different specialists and gone down many, many rabbit holes with no effect and or worsening of symptoms. So when she came to us, we did all of the tests that we took, all of the testing that she had done. We added in all the special tests that we do. And what we figured out is she had a parasite infection in her small intestine that was undiagnosed. She had another parasite infection of a different parasite in her liver. She had multiple toxicities and heavy metals within the gut. And she had some massive surgical scars from an unrelated surgery that were inhibiting the absorption of nutrients and medicines, which is a very, very common thing that scars do. And so we commenced a customized program to resolve the toxicity, remediate the parasites, and improve her digestion. And after 7 years of issues, we had complete resolution of the problem in 3 months. And this is a really cool case. And it was funny too, because she went back to her gastroenterologist and said, well, I have parasites. And, they confirmed it and whatever. And he still wouldn't believe it. So when she started releasing dead parasites, she took some and gave them to the gastroenterologist to get him to understand exactly the extent of what was going on. And so that was just sort of a funny ending to things. But this is just an important thing to understand, because you can do all of the right things, go down all these different rabbit holes and specialists and stuff, but you need to take a big zoom out and see everything that's involved. If we would have just dealt with the parasites, would have been successful? Possibly. If we just dealt with the heavy metals, would have been successful? Possibly. If we ignored the scar issue inhibiting the absorption, would we have been successful? Maybe. But when we take everything in its totality and address it appropriately and give the right things at the right time and do everything sort of in sequence, then we can win very quickly, okay? And actually create true lasting health. And that's what it's all about. So we're kind of at the end of what I wanted to cover today. And next time, we're going to dive deep into the root causes of gut problem. And I will just leave you with this. You are allowed to have more than one thing wrong with you. And I tell people this all of the time. So when we go over the root causes and you're like, man, it's like all of these things, potentially. I believe that the body is incredibly resilient and beautifully designed. And if we just had one of the things, we'd probably be able to overcome it quite quickly. But unfortunately, because of the society and modernity that we live in, a lot of things start to get stacked on top of each other, and then essentially the body can't handle it. And so understanding the root causes, we have to understand the interplay between all of them. It's not just parasites. It's not just a mold thing. It's not just a toxicity thing. It's everything altogether a lot of the times. And we have to work through everything in sequence. Okay. Thank you so much for joining me, and I will see you guys next time.